Thanks for coming in to see me, Mr. Gregory. Your doctor referred you so I can go through some aspects of your treatment with you.
That's good. To be honest, I don't really understand what I've got. The doctor said I have non-allergic asthma, but I've never heard of it.
It's okay, it can be very confusing. There are several different types of asthma. The most common type is caused by an allergy. However, it can also be caused by other factors. This is called non-allergic asthma.
The one I have?
That's right. As you know, you underwent several tests last week, which are used to diagnose asthma. You had spirometry done to compare how narrow your airways are before and after using an inhaler containing reliever medicine.
Yes, I remember. I also did a peak flow test before the spirometry.
Yes, the results are here as well. The peak flow test gives an idea of how open or closed your airways are.
That's what the doctor said. I had to do another test as well. It was called a pheno test. I'm sorry, I don't remember what it was for.
It's a test which measures the amount of nitric oxide you breathe out. The test is done to find out the type of asthma you have and compares allergic and non-allergic types of asthma.
Oh, I see.
You have low levels of nitric oxide. Your doctor used the result in conjunction with the history you gave her to diagnose non-allergic asthma.
What about my history?
You told your doctor that your asthma isn't triggered by allergies such as food or pollen.
That's right. I get a tight chest and start wheezing when the weather changes and the air is cold. I'm quite susceptible to cigarette smoke and some perfumes too.
That's because cold air contains less moisture than warm air. When you breathe in cold air, the airways can dry out and cause the airways to spasm.
Are the symptoms the same as for the other type of asthma?
Yes, the symptoms are the same. As you mentioned before, you get chest tightness and wheezing. The treatments of both types are similar, although there are some differences.
What's the treatment?
You'll use a salbutamol inhaler to relax the lung muscles if you are wheezing. Doctors tend not to prescribe steroid inhalers though, as they are only useful to minimize allergic responses.
Okay, so I use an inhaler. Anything else?
Yes. As you know what your triggers are, you should try to avoid them as much as possible. Prepare for colder weather and dress warmly before you go out, especially if you're about to do some physical activity. Cover your mouth with a scarf to warm the air before it reaches your lungs. Breathe through your nose rather than your mouth as well.
I'll do that. I always try to avoid places where people are smoking. Sometimes it's hard to keep away from people wearing perfume.
Yes, it is. That's why it's important to keep your inhaler with you at all times. It's recommended that you have an annual flu shot.
Oh, right. I don't usually have a flu shot, but I'll make sure I do this year.
You already said that you avoid secondhand smoke. That's right, isn't it?
That's right. Fortunately, I don't smoke myself. I never have.
That's good. There are some lifestyle changes which may help as well to minimize stress in your life. It can make quite a difference.
I don't see how stress could affect my asthma.
Stress causes the body to release certain hormones which can inflame the airways of the lungs and trigger an asthma attack.
I see. I guess I am under quite a lot of stress at the moment.
I'll give you a leaflet on relaxation techniques you may find helpful.